Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. We're taking your calls right here in the studio at 866-870-5752. That's 866-870-5752. And when you phone the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 studies and will teach you a lot of great information about what we're talking about here on the program. The foreword is written by Suzanne Summers, and Dr. Darrow has an amazing website, with all kinds of information and videos, www.lastemcells.com. That's lastemcells.com. What do you think?
I think it's amazing. I was just looking at my book, and on page 67, there is a photo of a failed back surgery with metal in someone's back.
Oh, I see it, yes.
That is just frightening to see these things. When I was in medical school, I did research on back surgeries, and the first time I saw the size of these metal screws that go into the vertebrae with the rods in there to hold the spine in place in a fusion,
yes,
I was literally aghast. My jaw just dropped, and I was talking to the surgeon, and I said, how is it possible that all that metal can go in the back? And for him, it's like, well, it's just we do that. That's what I do all day. You know, I'm a spine surgeon. And I studied with him, and believe it or not, I was going to do that work. And I did a study. I did one of the first studies on back fusions and the failure rates, which was very, very high. A lot of the fusions didn't hold, and a lot of people had nerves that were pinched by the screws. So it's just something that I kind of shied away from. And then when I was in medical school, I had a shoulder surgery that went bad. It wasn't the surgeon's fault. I still love that surgeon. He was a very, very hardworking guy, a great mentor for me. And he actually gave me the idea of injecting his knee when he was hiking. He used to hike in the mountains in Hawaii, and he would bring a steroid shot with him. He'd go backpacking. And sometimes after a day or two, he would have severe knee pain. He had arthritis in the knee, and he would inject his own knee. And then later, after, or actually it was during my residency, my 4th year residency, I started injecting myself. And I don't think I ever would have had the guts to do it other than I knew that he did it. And since then, I've injected both my knees and shoulders, elbows, my wrist. What else? I've had other people do my neck and back when I've been injured. I'm the lucky guy that no one said, you better slow down, because I love gymnastics and high-speed water skiing and surfing and windsurfing and every sport that I did. Even golf, I would get hurt because I'm such a repetitive athlete, and I like to really use my muscles. Weightlifting, I injured my shoulder doing that. So I've been injecting myself for almost 25 years with amazing success every single time. And I think I'm very lucky because not everybody gets the same results that I do. I'm not going to say what I do is the panacea for musculoskeletal pain, because it isn't. You have to choose your patients wisely when you're using platelets and stem cells. And that's why when people send me, I get emails all the time, with an X-ray or an MRI. And then the people say, look at this and tell me if you can help me. And in my office, I have photograph in every room of a fractured spine of a friend of mine, good friend of mine. It's severely fractured. So even someone who's never seen a spine X-ray before can go, ooh, that looks bad. And I say, how much pain does this guy have, do you think? And everybody goes, my God, he must be paralyzed. It looks so terrible. And the answer to the question is no, he has no pain. So Be careful. Don't let someone operate on you because of an X-ray or an MRI or a CT scan. Unless it's an emergency, of course, then you do it. But then we have to question what an emergency means, because a lot of things that are emergency to one doctor are not at all an emergency to someone else. And oftentimes when I question, when a new patient comes in and they've got a pretty severe injury, and I question whether or not my work can help them or whether they might need surgery, I will refer them to an orthopedic surgeon for a second opinion. And unfortunately, most of the second opinions are they need to have surgery right away, when I know that, they don't really have to. It's up to the patient. It's possible they may, but usually the surgeon will go, this is an emergency. Often they'll go, it's not an emergency, but you better get surgery right away. And those are the people that typically don't get the surgery, because who wants a surgery? We're smart enough today to know that there's a lot of bad side effects from surgery. I've seen endless infections. I've seen a few deaths, and it's very funny. There was a patient of mine I haven't seen for a while who texted me at about, she texted me during the day, and I wrote back immediately and I said, I'm with patients all day, but I'll get back to you tonight. So I got back to her about 9:30 at night last night, and we texted each other for a half hour. And she was in the quandaries of whether or not she should have a hip replacement. And we worked on her. We did one stem cell treatment on her. She got about 25% better, but she doesn't like injections. And I said, well, you don't like injections. How do you think you're going to like the injections you get when you get the surgery? Which is like so massive of an operation. And she said, there's about 35 to 65% of people who die after a hip surgery. And I said, well, I'm going to look it up. And I did. And I said, you're right. And she said, that's too high for me. I don't want to get that surgery. So we have to be kind of smart in what we're doing. Our culture is still a surgical and medical, medicines type of a culture, but it's moving away from that. And hopefully we're going to have something even better than what I do coming around the pike with arthritic joints. But right now it's not here yet. And I think what I do is the best thing we can do at this point, using stem cells and platelet therapy. And my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, I'm giving away for free if you call the show and talk to me now. Don't be afraid. I love you. The number to the studio is right now, 866-870-5752. If you want to catch me at the office, the number there is 800-300-9300. And I think it's time to punish Nita. What do you say, Nita? Are you up for it?
Yeah, I think we should rephrase that, because I don't really see it as punishment. I think you could call, we got a couple of possibilities. You call it Stump Nita, Make Nita Laugh,
okay.
Make me laugh, meaning you.
Here we go.
Okay.
What kind of streets do ghosts haunt? Dead ends. There we go. I finally got her to laugh today.
That is hilarious.
All right. You ready for another one?
Yes.
What kind of dogs love car racing? Lap dogs.
Oh.
You didn't laugh, Nita, so you get another one.
That was stumping me. That was stumping me.
I know. There was one day when you hit 2 in a row, so I think
know.
this...
I was trying to think on this dog question, I was trying to think of a breed. I was thinking in a different direction.
Okay, well, you got to open up your mind with these.
Yeah, that's why I like these. I really do enjoy these, because they do
make
me think.
These are brain stimulating and keep dementia away. So
we need that. Oh, look, Diana and Downey with a shoulder problem. Oh,
darn it! This next joke was so good.
Oh,
all right.
No.
Diana, we're going to go to you first. We're not going to keep you waiting. Diana, it's Dr. Marc Darrow. How's your shoulder doing? How long has it bothered you for?
Hi, doctor. Actually, I'm calling regarding my mother-in-law.
Okay.
She's 76, and she had a fall at a movie theater.
Ooh.
And she had already had an injured, it's her right arm.
Okay.
And she's been in severe pain for the last 3 weeks because they're waiting to do a surgery on her.
Oh, yeah.
And We just barely yesterday got her into a sling.
Okay.
Because it was just hanging. I don't know how to read. I don't know how to read X-rays, but I could look at the X-ray, and it seemed to me like the whole bone was out of place. But they're saying it's like tissue damage or something like that. Would she be qualified for what you do?
I have no idea because there's so many options of what it could be. Okay. And, if I saw the X-ray in this case, I could rule out a fracture. Did they say it's fractured or dislocated?
I feel like the bone doesn't even look like they're in the right place. It doesn't even look like it's hooked up. I thought at first her shoulder was out of socket.
Right.
But
the thing is, because you're not used to X-rays, you're not really the one who can determine that. So her doctor must have told her something. Do you know what the doctor told her?
They say it's a tear, and I can't remember everything that's wrong with it.
Well, the tears in the shoulder are typically one of the 4 rotator cuff tendons. And if that's the case...
they're talking about, doing a reverse shoulder replacement, whatever that is.
Yeah, I hope she doesn't have to do that. That's not a great surgery to go through. I haven't seen great success with them. Obviously, some people do get great success, but I haven't seen it. The ones who come to me, obviously, it didn't work on. So here's the thing. If it's just a rotator cuff tear and the shoulder, the humerus bone is in the glenoid and it's not dislocated and there's no fracture, then personally, just from what you're telling me, and I haven't seen her, I'm not her doctor, so don't go by what I'm saying. I'm just a guy on the radio. But from what you're telling me, there's no emergency there. Otherwise, they would have done a surgery already, right? With the fracture, they probably would have operated right away.
Why would they let her be in that amount of pain, though? It's like making her lose her mind.
I have no idea what's going on. If you want to, if you want to have her go to my website, which is www.lastemcells.com, and email me. Her phone number will be there, and I'll call her today, and I'll find out more information because it sounds like somewhere someone is not getting good information, which is not uncommon. Doctors are not the best communicators, unfortunately. That's not how we're trained. Now, my school we did something called problem-based learning, and it was more about communication than it was about science. We had to learn the science, but the dean of admissions was very adamant that he wanted people in his class that could communicate so we could be very good, loving doctors. Okay, so he chose me because I was an attorney at the time, and he figured that an attorney would be a pretty good communicator. So in my class, there were people who had been in other professions. He wanted that. He wanted people that were not fresh out of college, not people necessarily who had straight A's. He wanted people who could reach out and touch people who had a high IQ, but more so a high EQ, emotional quotient. And that was his goal in getting patients to heal. Science doesn't necessarily heal people. Sometimes it's the warm touch of a doctor and the communication that does. And I hate to repeat the story. I repeat it on a lot of shows, but we had a woman named Kathy call up a couple of years ago, and she was crying on the phone, and she said, "What happened to my husband? He had a neck surgery and he came out on a ventilator." And I said, "Well, I don't know anything about that. I wasn't there." I said, "What did the doctor tell you?" And she said, "The doctor came out to the waiting room after the surgery, said I did everything right, and walked away."
Ouch.
Yeah. And then, unfortunately, that patient died. He went to rehab, and he was on a ventilator, and he finally died from a neck surgery. Doctor told him, "Don't worry about it. It's easy. I do these all day long." So, I'm a very cautious doctor, and I do something conservative regenerative medicine is just injections. You walk in the office and you walk out.
Okay.
So I'm not a fan of a reverse shoulder replacement. I don't know the reason why they told your mother-in-law that she would need that, but I'm not a fan of it. Don't kill me. I'm just the messenger for my beliefs.
Okay.
I'm not the god of medicine. It's just, in my experience, my humble experience, doing this regenerative medicine work for almost 25 years, I don't see that most people need surgery. I'm just being honest with you. Some do. If you've got a fracture, you do. If the shoulder were dislocated, they could have just reduced it. So that wouldn't have been the problem. And now they're waiting all this time. So if they're waiting all this time, there's no emergency. And it's something that I don't, in my book, you don't run and get a surgery when there's no emergency for it. Because unfortunately, I get all the failed surgeries. The people where it failed come to me and go, can you help me now? And if it's a joint replacement, oftentimes there's nothing I can do because what I do is biological. We're just stimulating tissue to grow. Sometimes with a joint replacement, if it's outside of the joint and the tendons or ligaments around the joint, I can still help a person. But
because I'm sure it was from the fall, because she fell face forward and on her shoulder.
Yeah.
And I think it was already injured at the time.
Sure,
but
I gotcha. I'm so sorry for your mother-in-law, but my point of view is she needs a second opinion, and that second opinion should not be from the same type of doctor. It should be a different type. And if it were me in that situation, and look, I'm biased. There's no question about it. I am biased, because I see my work. I see the healings every single day. And I would go to someone who does regenerative medicine, who's one of the experts in the field. I wouldn't go to someone who does it once in a while. And I tell everybody who comes to me who wants a referral, they say, should I go to this doctor, that doctor? I go, first thing you do with the doctor is ask, how many of these procedures have you done today? And if they say none, how many yesterday? And if they say none, how many the day before? If they say none, how many last week? You get what I'm saying? You want somebody that does something. You want a doctor who does something all day, every day. That's the guy you want. Yeah. And I don't care if that's... Go ahead, I'm sorry.
Would you be willing to talk to her then?
Of course. Just like I said, have her email me through the website at www.lastemcells.com. She can do that right this minute, and I'll call her right back after the show in 10 minutes.
Okay. I thank you so much. I mean, I believe in what you're doing.
Thank you.
I had a severe shoulder injury, and I had a chiropractor. I had a doctor who told me they were going to have to do spine and shoulder surgery.
Yeah.
And I went to a chiropractor, and he told me, you're going to be healed. And in 3 weeks, I was able, I couldn't move my arm. They were going to schedule me for 2 surgeries. And in 3 weeks, it was totally healed.
Well, God bless that chiropractor. By the way, I just want you to know, I love chiropractors. I love them.
He was amazing.
Yes.
Yeah, so I believe in what you're saying. I think it's true. I think, that's alternative medicine, health and healing.
Yeah, but this is not alternative medicine that we do. This is the old style medicine. What I do, which is regenerative medicine, has been around on the planet since the beginning of time, just in cruder forms.
We're able to practice medicine now, Dr.
Oh, it's so limited. The FDA and the medical boards and all that have our hands tied behind our backs. I know.
I want to say thank you to you. It's an honor and a pleasure to talk to you.
Oh, you're so sweet.
Thank you for your service to
Thank you so much.
Well, because I think very different doctor.
Yeah, Diana, just be really honest with you. I love my patients. I absolutely adore them. And my life is devoted to my patients. It really is, and to the work I do. And, like I said, I was texting a patient at 10 o'clock last night. And that's what I love. And I'm lucky my wife is in medicine also, so she understands But I'm not the guy that's going to sit next to her watching TV at night. I don't do that. I do this full time.
Thank you for using your talents and your gifts to help our community, and I appreciate you. Thank you for
Thank you so much.
And I'm looking forward to her calling you.
Well, you know what I think the most important thing in medicine is? Bedside manner.
People.
Totally.
Oh, yeah.
Bedside manner.
I can tell. Yeah.
And look, I'm really great at it, and I can still have an off day. You know what I mean? Yeah. But I am the guy you can call up, because every patient gets my cell number and get a hold of me. Okay? I'm old school, like my grandfather was. He used to go to people's houses.
That's awesome.
Thank you so much, Diana. We appreciate your call.
Thank you both.
All right, Diana, we're going to go to Joe in just a second. I'm going to give out the phone number to the studio right now. Get a last couple of callers before the end of the show. The number here is 866-870-5752, 866-870-5752. And if you want to email me, go to the website at www.lastemcells.com. Joe, how are you doing? You have surface nerve damage, you think. Tell me about it. What happened?
Well, about 5 years ago, I contracted shingles.
Okay.
And so I took an antiviral. I had initially the left side of my face was pretty roughed up. I had small ulcers that typically occur with shingles. Anyway, I took the antiviral. It was a 9-day treatment. It effectively stopped, any further transmission or spread of the shingle. But what I've had is a progressive, and I've talked to a doctor about this. I've had this progressive, more surface-related discomfort. It's now basically around my eye, so it's like the top of my cheek and around my eye to the top brow.
Okay.
And what they've suggested is that the shingle virus basically deteriorates the sheath of the nerves.
Sure.
And so that is a one-way process. It's not something that can be grown back.
Okay.
And that what I'm dealing with is that degeneration that occurs or did occur and perhaps is still occurring over time.
Okay. What are the symptoms you have? Is it burning, numbness, tingling? What is it like?
It would, like right now, it almost feels, burning and coolness are kind of two edges of the same coin.
Okay.
So it feels, it's not painful.
Yeah, I get you. It's just irritating and annoying.
It's incredibly annoying, and sometimes it feels like it's interrupting my eyesight. I don't believe it is. I think that's kind of just
I get it. Yeah, it makes sense. It makes sense. Let me say something, Joe, because we're running towards the end of the hour, and I want to get this out quick. You have what's called post-herpetic neuralgia, and I've had very good luck getting rid of it many, many, many times over the years by doing something called neural therapy. And you can look that up. It's an old German form of injection that I studied. So it's something that if you want to come in, I'll take a look at. I've never done it around an eye before. Usually people have it from their back radiating around to their chest. Those are the ones that I've seen a lot of. So that's it. You can call us at the office at 800-300-9300. You can go to the website and email me every page there at www.lastemcells.com. Thank you, Nita Valens. You're an amazing host. Thank you, Alex and Suzette and the whole crew. We love you all. Thank you, callers.
We love you too. And listen to our pal, The Pet Show, from 11 to 1 every Saturday. I'm Nita Valens. Thanks for listening.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.